Hello, my name's Rachel. I'm a midwife practitioner here at BPAS. Today I'm going to safely talk you through how to carry out an early medical abortion at home. It is important to know you cannot do this treatment at home after 9 weeks and 6 days of your pregnancy. Your confidential package will arrive containing the necessary medications for this treatment. You should have steps 1, 2 and 3. These are your medications, and step 4 is the pregnancy test and an information leaflet. In preparation for you doing the treatment at home, we do advise, if possible, you get ibuprofen, paracetamol. This is for pain relief, which we will come back to during this video. During your treatment, use thick sanitary maxi pads as opposed to tampons. This will safely help you assess your bleeding. The aftercare service is available 24/7, and if you do have any concerns along the treatment, you can call 0300 333 6828. It's important that the steps are followed in the correct order. Step 1 and 2 are inside this box. Your step 1 is to swallow whole with a glass of water a tablet called mifepristone. And this tablet is going to prepare your body to pass the pregnancy by blocking the pregnancy hormones and softening the cervix. This tablet takes effect over 24 hours, during which you can generally continue with your daily activities. Some people will not experience any symptoms, as symptoms can vary. You may experience some vaginal bleeding and or some abdominal cramping, which are both normal, but if you are worried, call the aftercare line. 1 to 2 days after you've done step 1, you then proceed to step 2. We would recommend you complete step 2 at a time when you're able to relax and look after yourself. You can either use the misoprostol tablets vaginally or in your mouth. If opting to use the pills vaginally, lie down and insert 4 misoprostol tablets using your finger to push them as high as comfortably possible. Remain lying down for 30 minutes after insertion. Don't worry if the tablets do fall out after this time, or you see them pass once you start bleeding. It's just the chalky residue of the medication, and as long as they remain inserted for 30 minutes, they will work. Alternatively, you can dissolve these tablets in your mouth by placing them between your teeth and gums for 30 minutes. Followed by a drink of water to swallow whatever fragments may be left behind. If you have started bleeding after step 1, taking the misoprostol by mouth is preferred. If you take these tablets by mouth, you are more likely to experience nausea and diarrhoea. The misoprostol tablets do cause your uterus to contract, and this will pass the pregnancy. You should experience some vaginal bleeding. You may experience some blood clots and abdominal cramping. The side effects to the misoprostol tablets can be sickness, diarrhoea, fever and headaches. This treatment can be painful, and the best way for you to manage this at home is to take some pain relief. If you're able to, at step 2, take 800 mg of ibuprofen. You can then also take 1 gram of paracetamol. Some people do have codeine in the package. Please follow the instructions as prescribed. Codeine can cause constipation and dizziness. These side effects do normally resolve after 24 hours. You may also want to use a hot water bottle, relaxation techniques, having a warm bath. These things can all help with your discomfort. You can also eat and drink like normal during this treatment. For the next part, please refer to the bleeding diagrams in your booklet. If 4 hours after step 2 you do not experience bleeding, or if only scant bleeding occurs, like spotting or smearing as displayed on diagram 1, then you should proceed to step 3. This is what your step 3 looks like. Use 2 more misoprostol tablets as before, either by inserting them vaginally or dissolving them in your mouth. If you don't use step 3 tablets, please return them to a local chemist or BPAS clinic for their safe disposal. This treatment is prescribed for you only for this specific pregnancy and is based on your medical history. If you're unsure about the bleeding, please contact the aftercare team line. For some, the pregnancy will pass over 4 hours. This time frame can vary. If you were scanned before treatment and a pregnancy is confirmed in the correct place, we can allow up to 5 days for the bleeding to start. If you were not scanned before the treatment and have had no bleeding 24 hours after the medication, then please call our aftercare team. Once a pregnancy has passed, your bleeding and pain should settle. For a few days to 2 weeks later, you may continue to experience bleeding. This can continue until your next menstrual cycle, 4 to 6 weeks after this treatment. It should be intermittent. So bleeding can vary, so you may have some spotting, or it may be like a period or sometimes heavier. However, if you are filling 2 maxi pads within 1 hour for 2 hours or more, or if you experience flooding, gushing or large blood clots, please call the aftercare team immediately. Step 4 involves taking a pregnancy test 3 weeks after mifepristone use. This test is specific to this treatment and differs from standard tests you might buy in a store. The result should be negative, confirming a successful early medical abortion. If the result is positive or inconclusive, then please call our aftercare team. We understand that a positive or inconclusive result can be unexpected and scary. BPAS are here for you and will help you. A positive or inconclusive result does not always mean your pregnancy is continuing, but we do need to check that all the pregnancy remains have passed and make sure that you are okay. The pregnancy test we sent you should be used 3 weeks after step 1. The sample needs to be the first urine sample of the morning. This is a diagram of your pregnancy test. Remove all packaging. Remove the cap from the test. As you urinate, hold the absorbent tip of the test in the urine stream, or collect some urine in a clean pot and dip the tip into the urine for 5 to 10 seconds. Wait 5 to 10 minutes. Read the pregnancy test. If your result is positive or invalid, please contact the aftercare team on 0300 333 6828. Please refer to your booklet for the important, unusual, unexpected symptoms and call our aftercare team if you experience any. For emergencies, call 999 or attend your accident and emergency department. For further information, please visit our website, refer to your booklet and the self-assessment checklist. Thank you.